Hi, my name's Phil. I like talking about politics, and in this video I'd like to discuss the wisdom of the Conservatives wanting to focus the public's attention on the NHS, as well as some of the specific policies they're trying to announce this week, along with a look at the reality of what's actually happened to healthcare under the Conservatives. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel. So I applaud the Tories for their gumption, I really do. Last week, the government focused attention on asylum. It ended up with the government exposing its own incompetence with the evacuation of their plague barge and the deaths of Afghan asylum seekers, exposing the lack of safe legal routes for people who are very obviously fleeing persecution from a very obviously not at all safe country. Essentially, their asylum week did not go very well for them. So I can only imagine what was being said in the room when they decided to use this week to focus on the NHS. I like to imagine there must have been one advisor in the room. One advisor that Sunak hires who actually knows what they're doing and is just ignored by the greater number of muppets around them. You know, I can imagine them putting their hand up and asking, well, after the stellar success of deciding to focus on asylum, something you think is a strength, is it really wise to get the public to look at the state of healthcare? You know, after all, Sunak promised to reduce waiting lists at the start of the year. Nice and easy, he must have thought. He didn't say how much he'd reduce them by. Should be simple. All I have to do is make them go down by some amount and I get to claim I've done it. Only problem is they're going up, not down. And given that this particular pledge is failing hard and the Tories have been working hard to distract the public from policy areas that are on fire, I would be asking him as an advisor, Prime Minister, really, you want the public to start considering the state of healthcare, do you? Oh, just one question, Prime Minister. How much are Labour paying you? But if such an advisor exists, they were overruled again. The NHS it is. So before I look at the reality of what's been happening to healthcare, what are the Tories announcing? What's their grand plan? Well, first of all, what they say is they're going to fund an extra 900 beds ahead of this winter. Labour's Shadow Health Secretary Wes Streeting described the move as sticking plaster. I disagree. Sticking plaster is usually a term to imply a measure that doesn't do enough, something that is woefully inadequate, but does at least do something beneficial, better than nothing, basically. But I don't think it does that. I had two immediate thoughts to this 900 new beds announcement. The first is we have had years of winter crises under the NHS. If it was as simple as funding 900 extra beds, why didn't they do that years ago? Second, it's that do you remember they funded a load of extra beds in 2020? Do you remember? The Nightingale hospitals, set up as temporary hospital wards to deal with the influx of COVID patients. Marvellous feat of logistics it was. The only problem was that the beds almost exclusively went unused because there were no doctors or nurses to staff them. Turns out if you just dump a patient in a bed, they don't get any better. So now you think about these 900 new beds and you realise that would sound nice if it was going to go with the doctors and nurses to staff them. But we already have too few doctors and nurses for the beds we already have. So those doctors and nurses are already stretched amongst too many patients. You realise that what the Tories' plan actually is to spread the already overstretched medics across even more patients, leading to a further dilution of care, poorer outcomes, more disillusioned staff leaving the NHS. That last part's not a problem for the Tories, though, is it? They have been actively encouraging staff to leave the NHS in order to claim that the publicly funded model is failing and that we should all either pay for private care or do without. In fact, the government actively encourage people to go private right now. The aim is quite clear. It's to get as many people as possible used to the concept of having at least some of their healthcare needs met privately, so that they can remove some services from the NHS altogether, then over time isolate the poorest from the better off so they can bin the NHS completely. According to a report I saw earlier this year, the number of people in the UK using private healthcare has doubled to 22% since 2019. Make no mistake, the Tories' plan for the NHS is oblivion. In the meantime, all those responsible make out like bandits because they've got shares in private healthcare companies. Keir Starmer has said the NHS would be finished if the Tories win another election. Now, You can argue that, of course, he'll say this because he's motivated to sound the alarm about the Tories being given another term in office, because he would like that term in office. But I don't think he's being alarmist at all. In fact, if Labour were not on for winning the next election, I would say that's all over for the NHS. Gone, finished. I seriously think we're in the end game now. Too many people see the Tories wrecking the NHS and think it's Labour's job to just come in, repair the damage when they return to power. There's actually very little left. I don't think people realise how little there is left. Much of the NHS is already privatised. Like, even if you think you're getting NHS treatment, quite a lot of the time you're not. You know, you think you are because you're not actually paying for it directly. You're paying it through your taxes. It's still coming from public funding. But what you're actually getting is private treatment, which is just being paid for out of the public purse. We've literally just, there's a few years from the Tories being able to disband the NHS and all the existing hospitals and clinics simply revert to their own private healthcare providers. They could easily do it in the next Parliament if they win the election. There is simply such a distinction between Conservative and Labour governments in my lifetime that it's impossible to see the data and not conclude that the Conservatives have no interest in providing universal healthcare. The Financial Times produced this famous chart showing NHS waiting lists under two different Conservative periods in office, sandwiching a Labour administration. Also how Labour boosts spending as a proportion of GDP, which is the important metric. We can see that the last Labour government kept redefining waiting lists in order to include more and more NHS patients. Because when they came to power, the Conservatives were monitoring it as well, but they're monitoring a very specific section of the NHS patient population. Every time Labour said, no, we're going to include more patients in it and more patients in it, the waiting list went down. This is because they set targets and made sure that the resources were there to meet them. Yes, PFI was not a good long-term strategy. I was very irritated by it at the time, but the outcomes were there, and really that's what voters care about. Look what happened when the Tories came to power. Now, because the Tories keep failing their own targets, what they do is they just get rid of them. So there used to be targets for wait times in A&E. They failed them, so they lowered the targets, failed them again, so they just got rid of them. They're doing the same now with other targets. Although that won't work anymore. The outcomes are what matter, and the outcomes are absolutely terrible. The Tories are reduced to blaming doctors now for high waiting lists. They tried to blame nurses last year, that didn't really work. So now they're trying to blame doctors. You watch with paramedics next. Then the canteen workers. Finally, it'll be the guy who paints the lines in the car park. It'll always be someone else's fault but theirs. But voters aren't interested in blaming NHS staff. If a government doesn't think it has the power to be responsible for the state of the country, then they can vote for one who does. I remember in 2019, Boris Johnson saying, oh, I can't do anything because I've got a minority government. Vote me a majority and I can do all these things. What happened? He was voted a majority, a large majority. What did he do with it? Blamed everyone else that things weren't running right. Oh, it's not my fault. Whose fault is it then? But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.